All right, guys. So today somebody asked me to differentiate between um gastric ulcer and peptic ulcer, and I thought this could also be very useful for you too. So, what is gastric ulcer and what is peptic ulcer? Let's get started. Now, we start with peptic ulcer because peptic ulcer is actually encloses gastric ulcer. That is, peptic ulcer is a general term for ulcers or tears that occur in the GI tract. So, tears that occur in the GI tract from the esophagus to the stomach to the small intestine are all peptic ulcers. But we have two common ulcers. Like under peptic ulcers, we have two common ulcers, which is a gastric ulcer and the duodenal ulcer. And as I've already said, ulcer is basically a tear in the lining of the organ that is being talked about. In this case, it is the GI tract. Now, how do you differentiate between gastric ulcer and duodenal ulcer? Gastric ulcer and duodenal ulcer are actually different based on what is listed here. Number one, we have location. Now, for gastric ulcer, the location is in the stomach, so the tears are in the stomach. And for duodenal ulcer, the tears are in the upper part of the duodenum, that's towards the pyloric sphincter. So this upper part of the duodenum is called the pyloric part of the duodenum because it is close to the pyloric sphincter and the pylorus. Now, what's the cause? What's the cause of gastric ulcer? Gastric ulcer is caused mainly by Helicobacter pylori, which is a bacteria that weakens the defense system of the gastric mucosa. So there is not enough uh, gastric mucus to actually protect the stomach lining from the ACL, that's from acid secretion. Meanwhile, the cause of duodenal ulcer is basically or primarily increase in HCl secretion, that's increase in acidity of the content entering the duodenum. Now, the acid secretion, I think we already have a clue to that. But surprisingly, however, the acid secretion in the gastric ulcer does not actually increase in most cases. Sometimes it might even decrease or be normal because the main factor that causes gastric ulcer is not actually the increase in acidity, it is the decrease in defense of the gastric wall. Because on a normal, the concentration of HCl in the stomach is already enough to digest it. What's protecting this digestion is the gastric mucosa. Now, when the defense of this gastric mucosa now weakens, now it causes ulcers. That's why we have gastric ulcer most of the time. But for the duodenal ulcer now, that's what you've been thinking. There is actually increase in ACS secretion, that's increase in acid secretion. The only case where acid secretion can actually cause gastric ulcer is in Zollinger-Ellison syndrome, which is a rare condition where there is hypersecretion of HCl so much that the gastric mucosa can no longer contain it.
Power it off.
Now, the last thing we have here is effect on body weight. So, what's the effect of gastric and duodenal ulcer on your body weight? For gastric ulcer, there is a decrease in body weight. This is because of the physiology behind gastric ulcer. So, when a patient has gastric ulcer, they tend to lose weight because whenever they eat, the pain does not actually reduce. In fact, the pain increases for gastric ulcer because the tear is in the stomach, and whenever food enters your stomach, it causes secretion of HCl, which will increase the pain you are feeling. But for the duodenal ulcer this time around, the pain actually decreases. So I think you should identify that now. So when they talk about a type of ulcer in which food is able to alleviate the pain, you should start thinking of duodenal ulcer, not gastric ulcer. So yeah, I think we've covered a whole lot from that, and I hope you gained something. I have the full notes here on everything I've just said. So if you just need the notes, I have a group I just created on TikTok here. Just make sure to send me a DM, then I'll add you to the group where I'll be dropping all these notes. Now let's look at a clinical scenario before we round up. So this clinical scenario says a 35-year-old man complains of epigastric pain that wakes him at night and it is relieved by eating or taking antacid but returns a few hours later. So what is your diagnosis from what you've learned? I'll be hoping to see your answer in the comment section. So please like, share, save, follow and comment. Bye.